Starting your career as a new graduate nurse can be both exciting and challenging. Hospitals and healthcare facilities are looking for nurses who are not only clinically competent but also compassionate, adaptable, and ready to collaborate with experienced staff. As a new grad nurse, your interview will often focus on your educational experience, clinical rotations, and how you handle patient care, teamwork, and high-pressure situations. Employers know that new nurses may not have years of hands-on experience, but they do expect a solid foundation in nursing knowledge, critical thinking, and professionalism. Your responses in the interview provide insight into how well you can transition from classroom learning to practical patient care, how you communicate with colleagues and patients, and how you manage stress in a healthcare environment. This video will cover common new grad nurse interview questions, sample answers, and practical tips to help you present yourself as a confident, competent, and compassionate candidate. Common new grad nurse interview questions and answers. 1. Why did you choose nursing as a career? Here's how you can answer. I chose nursing because I want to make a meaningful impact on people's lives. During my clinical rotations, I realized how rewarding it is to provide care that improves a patient's health and well-being. Nursing allows me to combine my passion for science with my desire to help others every day. Tip: connect personal motivation to compassion, patient care, and long-term commitment to the profession. 2. How did your clinical rotations prepare you for this role? Here's how you can answer. During my clinical rotations, I worked in medical surgical units, pediatrics, and emergency care. I gained hands-on experience with patient assessments, administering medications, and documenting care plans. I also learned to communicate effectively with patients, families, and interdisciplinary teams, which gave me confidence in my ability to work in a real healthcare environment. Tip: highlight a variety of experiences and transferable skills gained during rotations. 3. How do you handle stress in a fast-paced environment? Here's how you can answer. I manage stress by staying organized, prioritizing tasks, and focusing on one patient at a time. During clinical rotations, I often faced multiple patients with urgent needs. I used checklists, collaborated with colleagues, and remained calm, which helped me deliver safe and efficient care even under pressure. Tip: employers want to see that you remain calm, focused, and effective in stressful situations. 4. Describe a time you had to handle a difficult patient or family member. Here's how you can answer. During my pediatrics rotation, a parent was anxious and frustrated about their child's procedure. I listened carefully to their concerns, explained the steps of care, and reassured them. By maintaining empathy and clear communication, I was able to ease their anxiety and ensure the patient remained calm throughout the procedure. Tip: emphasize empathy, communication, and professionalism. 5. How do you prioritize patient care? Here's how you can answer. I prioritize care based on the urgency of patients' needs. For example, patients with critical conditions or new admissions are addressed first, followed by routine assessments and scheduled treatments. I also coordinate with the healthcare team to ensure continuity and safety of care. Tip: show understanding of triage, clinical judgment, and time management. 6. How do you handle feedback from senior nurses or supervisors? Here's how you can answer. I welcome feedback because it helps me grow as a nurse. During my rotations, I often received guidance on charting, medication administration, or patient interactions. I listen carefully, ask clarifying questions if needed, and implement the advice immediately. This approach helps me improve and provide better care. Tip: highlight openness, willingness to learn, and professionalism. 7. How do you ensure patient safety and minimize errors? Here's how you can answer. I follow protocols diligently, double-check medications and dosages, verify patient identities, and document care accurately. For example, I always follow the 5 rights of medication administration. If I notice any discrepancies or potential risks, I immediately report them to the supervising nurse to ensure patient safety. Tip: emphasize vigilance, adherence to protocols, and proactive problem solving. 8. Describe a time when you worked effectively as part of a healthcare team. Here's how you can answer. During a busy medical surgical rotation, I collaborated with nurses, physicians, and therapists to manage a patient with multiple complications. I communicated updates, assisted with procedures, and coordinated care transitions. By working as a team, we ensured the patient received timely and comprehensive care. Tip: highlight collaboration, communication, and teamwork. 9. How do you handle a situation where you are unsure about a medical procedure or decision? Here's how you can answer. If I am unsure, I immediately seek guidance from a senior nurse or physician. Patient safety is my top priority, so I avoid making assumptions. For example, during a medication administration, I encountered an unfamiliar dosage calculation. I consulted my preceptor, verified the correct dose, and safely administered the medication. Tip: show humility, responsibility, and a commitment to patient safety. 10. How do you deal with emotional situations, such as patient suffering or death? Here's how you can answer. I acknowledge my emotions but maintain professionalism to provide the best care possible. I use debriefing sessions with colleagues, reflection, and self-care strategies to process difficult experiences. This approach helps me stay empathetic without letting emotions interfere with my responsibilities. Tip: employers value emotional intelligence and resilience. 11. What are your strengths as a new grad nurse? Here's how you can answer. My strengths include strong clinical knowledge, adaptability, and empathy. I am eager to learn, and my rotations have equipped me with a variety of experiences. I also prioritize clear communication with patients and colleagues, which helps me provide safe, patient-centered care. Tip: choose strengths that highlight both technical skills and interpersonal qualities. 12. Where do you see yourself in 5 years as a nurse? Here's how you can answer. In 5 years, I see myself as a registered nurse with advanced certifications in a specialty area like critical care or pediatrics. I also hope to mentor new nurses and contribute to improving patient care processes within the unit. Continuous learning and growth are important to me. Tip: show ambition, long-term commitment, and dedication to professional development. Tips for excelling in a new grad nurse interview. To succeed in a new grad nurse interview, preparation is key. Here are some strategies. Know your clinical experiences. Be ready to discuss specific examples from rotations, including how you handled patients, collaborated with staff, and followed protocols. Emphasize soft skills. Compassion, communication, teamwork, and adaptability are crucial for new nurses. Highlight them in your answers. Demonstrate problem solving. Employers want nurses who can think critically and respond effectively to unexpected situations. Show eagerness to learn. Being a new grad means you are still growing professionally. Display enthusiasm for learning and seeking guidance. Professional presentation. Arrive in clean, professional attire, maintain good posture, and communicate confidently and clearly. Additionally, consider preparing a few thoughtful questions for the interviewer about orientation programs, team structure, or opportunities for continuing education. This demonstrates genuine interest in both the role and the organization. Conclusion. New grad nurse interviews assess your readiness to transition from training to professional practice. Employers want to see that you have the clinical knowledge, compassion, teamwork skills, and resilience to handle the demands of a healthcare environment. By preparing examples from your clinical rotations, demonstrating emotional intelligence, and showing eagerness to learn, you can make a strong impression. Approach your interview with confidence, professionalism, and authenticity, and you'll show that you are ready to provide high-quality, patient-centered care as a new graduate nurse.